morning. Thanks for the opportunity to speak in front of you. With me today, I'm Ed Nielsen, by the way, Executive Vice President of the Pennsylvania Chiropractic Association, founded in 1931. With me today is Dr. Glenn Zalata, a clinician in Northeast PA, and he's also our liaison to the American Chiropractic Association. We do appreciate the opportunity to speak to an issue that has yet to be covered, at least in this particular hearing, and that is access to what? So that's what I'd like to speak to, and obviously, given our predisposition for chiropractic, we're going to argue for chiropractic. PCA represents over 4,000 licensed doctors of chiropractic and the 20-plus million people who reside in the Commonwealth who potentially will use chiropractic services. We believe that effective national health care reform will only achieve maximum benefit to the public when coupled with a broad transformational paradigm shift to a forward-thinking health system that focuses on comprehensive wellness care, healthful lifestyle choices, and disease prevention. The evidence is extremely convincing and compelling that such reforms are both timely and urgently needed, especially in the face of the looming provider shortage and the unprecedented demands our population, baby boomers like myself in particular, will place on the existing dysfunctional delivery system. If it is indeed the broad intent of the PPACA to lower costs while providing for increased competition and freedom of choice, this cannot be achieved without ensuring increased access to a diverse set of key healthcare providers, as legislated and intended by in the PPACA, including doctors of chiropractic. As required, the Commonwealth will be creating and regulating the Pennsylvania version of the PPAC-mandated state health insurance exchanges, PEHC, at least my acronym for what the collaborative is going to be about, essentially to fulfill the PPAC mandate passed by the U.S. Congress in the spring of 2010. The PPACA includes essential health benefits that must be provided by all eligible plans. On behalf of our chiropractors, the 4,000 plus that we represent, PCA remains adamant that essential health benefit regulations include access to chiropractic services in each individual's respective healthcare plan. Although the specific types of services that must be included in an essential health benefits package were not fully delineated in PPACA, Section 2706 of Section 1201, which sounds like a lot of bureaucratic jargon, the Congress legislated that an entire type of healthcare professional cannot be excluded from the network. The non-discrimination provision of Section 2706 is very important to our patients, as it ensures that insurance plans cannot discriminate against providers with respect to participation and coverage if the providers are acting within their scope of practice under applicable state law. The PCA seeks to ensure the full applicability of Section 2706 to insurance plans, including ERISA and state exchange plans, as the primary mechanism to ensure that doctors of chiropractic and others can provide services in the newly regulated environment created by PPACA and the PEHC, and to ensure that no language is adopted at the state level relative to essential benefits that would specifically exclude the services provided by or participation of doctors of chiropractic. The definition of essential in the context of an essential benefits package has its roots in state mandates and federal health care programs. Essential benefits for which we advocate are appropriate and cost-effective services that are also included in the majority of state mandates for covered healthcare services. Chiropractic services fit well under the general categories of ambulatory patient services, rehabilitative services, or preventive and wellness services, as well as chronic disease management. Chiropractic is firmly anchored in the national healthcare system as well. At the federal level, chiropractic care has been a covered service in Medicare, federal workers' compensation, and the Blue Cross Blue Shield Federal Employee Health Benefits Package. Chiropractic care is also available to members of the U.S. Armed Services at more than 40 military bases in the U.S. and available through the VA as well at their healthcare facilities. Here in Pennsylvania, chiropractic care is a covered service under Medicaid, first-party automobile coverage regulated by Act 6, workers' comp regulated by Act 55, and state workers in the Pennsylvania Employee Benefits Trust Health Insurance Benefits Package. Clearly, at both state and federal levels, the unique care that chiropractors provide has already been determined to be an essential benefit of any viable healthcare benefits package. With the looming provider shortages and rising costs, the present system offers too many roadblocks and detours for a systemically and financially sustainable delivery of care. In the process of reform, in whatever form that may take, the chiropractic profession remains committed as an eager partner, dedicated to new policies and approaches that link and place cost effectiveness to quality of care, timeliness of care, patient rights and freedoms, integrity, and most importantly, patient safety at the top of our priority list. We believe that you share that same sense of priority. Research consistently demonstrates that chiropractic care has a record of safe and effective conservative care and has been shown to be cost effective. DC's chiropractors utilize a holistic wellness approach that includes the full range of standard case management services, including extensive diagnostic, treatment, and technological skills. The PCA recognizes the difficulties inherent in the kind of major paradigm shift that must take place to stave off catastrophe in healthcare. Such actions can and should be centered on a fundamental shift from end-stage, high-cost, quote, sick care, close quote, interventions based on hospital-based treatments and surgery and increasingly expensive drugs and technologies toward a model predominantly focused on outpatient wellness promotion, making maximum use of the kinds of procedures and methodologies practiced by doctors of chiropractic and many of our primary care colleagues. The Commonwealth has an extraordinary opportunity, a unique moment in time, if you will, with healthcare reform to get it right. I have been around healthcare on and off for the last 25 years, so I know what it was like way back in the early 90s. In the interest of our residents and those hundreds of thousands of patients treated by chiropractors every day, PCA commits itself to partner with the Commonwealth and all stakeholders to make the promise of meaningful healthcare reform a reality here in the Commonwealth. Thank you, and we're happy to respond to any questions you might have.
Thanks, Ed. I guess the point you make in terms of we still need to the essential benefits package and the design is still a big question for a lot of us. But I mean, I think is your point less essential benefits though, and then more the importance of emphasizing and protecting the non-discriminatory provisions of PCA and those that exist currently in state law that I think also protect?
I think the answer is yes. It's a little bit of both. We do believe that the essential health care benefits need to have a shift to a degree toward preventive and wellness care. Obviously, we are very concerned about making sure that the non-discrimination clause in 2706 remains intact here in the Commonwealth, too.
Just to elaborate a little more, the non-discrimination, are you saying if the feds place chiropractic care as an essential benefit, that any carrier will have to contract with any chiropractor that wants to be in the network? And if they don't, if there's some selection in terms of who gets to practice in a particular provider network, would that be, in your opinion, discriminatory at that point? Or what's the scope, I guess, of the discriminatory language in your mind?
I think that the scope is fairly all-inclusive, quite candidly, and I think that DC's chiropractors need to be included at all levels. That would be our argument. We also recognize it's a private sector initiative that they can do essentially what they want to do. That said, when you look at what patients want and the level of satisfaction that patients get from their relationships with chiropractors, the coming issue of Consumer Reports, admittedly not scientifically solid, but chiropractors come out on top of all healthcare providers related to lower back pain and neck pain resolution. We think that those kinds of consumer perspectives are important to maintain as you look at what you're going to shape here. What private insurers do on their own, that's their call. Obviously, that's a private company issue. When we talk about this particular exchange, though, we would argue that chiropractors need to be included